Aloha, welcome to Healthcare in Hawaii. I'm your host, Josh Green, Senator from the Big Island and ER physician. Today we're going to focus on something a little different. We've been focusing over these many months on large-scale systemic questions in the healthcare system, but I cared very deeply about an issue that's been evolving here in our state, and that's care for people with neurodevelopmental disabilities. Today I'm going to introduce you to two of the best people in our state that work with children that have great challenges. My first guest is Dr. Ryan Lee, who's a neurodevelopmental pediatrician. Our show is entitled Neurodevelopmental Disabilities at Shriners, and why? Because he's one of the lead physicians at Shriners working with children who have these challenges. I'm also joined by Miki Wong, who's a registered dietitian and has been using innovative treatment capacity to help these same children that Ryan Lee takes care of as a team member at Shriners. So welcome, guys.
Thank you.
Good to see you,
Thank
Miki.
you.
Thanks for having us, Josh.
Great to see you. At the Capitol, we've been having an interesting dialogue about autism, but Shriners does so much more. And I wanted to really introduce you guys to our audience and let them see into kind of the world of Shriners. Even my eyes were only recently opened about the full capacity of services that Shriners offers to the people of Hawaii. So would it be okay if we started just with a little kind of intro from you guys on what Shriners is like, what kind of services are offered, what kind of patients you see?
Sure, I'd start with that. Shriners is a 22 hospital-wide system throughout the United States, Mexico, and Canada. And our hospital in Honolulu is among the oldest. We're second oldest to the Shreveport Hospital. It's over 90 years old. And as a mission, Shriners provides care for the child with what they call a crippling disability, regardless of their ability to pay for it. And so within that scope of care, they provide care for children with musculoskeletal and orthopedic problems, burn care, and now neurodevelopmental disabilities. Our hospital in Honolulu is the first to hire a medical staff neurologist such as myself to expand care to take care of children with all types of developmental disabilities, including autism. However, when Shriners first started 90 years ago, it was known mainly as a polio hospital and a hospital for children with cerebral palsy or disorders of the musculoskeletal system.
Right.
And today we know that caring for these children is more than just an orthopedic surgeon's job. And so we have multidisciplinary care teams at Shriners, including physical therapists, occupational therapists, recreational therapists, speech and language therapy, registered dietitians, nurses, anesthesia, and plastic surgery, and now neurodevelopmental disabilities to provide well-rounded care for the whole child. We know that the child with developmental disabilities has multiple medical needs, and so we want to provide care at Shriners as a subspecialty hospital, specifically meeting all the needs of these children.
And is that how you fit into the team, Miki? Tell me a little bit about that. So I guess in kind of in the lay community, just like Ryan was describing, even I thought of it as, oh, okay, that's a place where children with serious musculoskeletal problems go and they see their physician. But you're describing a very different team and a very different supportive process. So what is it that you add to the team? How does that work?
So my work is part of a multidisciplinary team approach to our across the spectrum, the orthopedic and the neurodevelopment kids, and providing nutritional care. And some, they come with different issues. Some are failure to thrive.
Yes.
They don't grow well, and so they need nutrition intervention for those causes. Some of them have other problems related to pediatric obesity, and those conditions impact their health and their condition, or certainly their orthopedic conditions as well. Right. And in the neurodevelopment clinic, we were working a lot, which I guess we'll talk about later,
Yes.
Trying different dietary approaches to addressing behavioral issues.
I definitely want to get into the details of that because it's so relevant to kind of the challenges we have in all of healthcare today, especially people's diet, especially the impact of obesity, and just it's become in some ways the exploding issue in healthcare, and many of my guests on the show have mentioned it. So we have an expert with us today, which pleases me. What you're describing to me, guys, is interesting because it kind of sounds like a reflection of the transformation of the healthcare system. The healthcare system historically has been very siloed, has been very fragmented, has been very focused on just diagnosis codes and diagnosis challenges and treated in a vacuum in some ways. And then it seems like now the healthcare system is integrating. And you guys seem to be a very excellent example at Shriners that now you've not only integrated neurodevelopmental disabilities into the hospital, but you've also integrated full teams. Is that a fair assessment?
That is fair, and we're just trying to answer the call to patient needs. When you sit in an office with a family, say of a child with cerebral palsy, a movement and posture disorder,
right.
We can't just address one of their needs and send them out the door and say, move on. They may also not only have orthopedic needs, but they may also have speech and language problems, socialization issues. They may have seizures, right. And they may have problems with feeding. And so we would like to, yes, break down those silos, but also work with some other agencies, such as the Department of Education, Department of Health through our care management services, to provide what the child needs and what the family needs to help each child reach their potential, contribute to society in some way.
Now you said that this is fairly new, that neurodevelopmental disabilities has been recently added to Shriners. Unpack that for me a little bit. When did it start?
Sure. So it started when I came in 2013. Okay. I arrived the summer of 2013 following my training on the East Coast. Right. And we had planned to launch on 9/11, 2013, the Neurodevelopmental Clinic. It went fine.
Yes.
But we had been in planning for about a year, discussing how we can best approach the broader scope of needs amongst the island, in fact, because we had seen that children not only with autism but with ADHD, with intellectual disability, and with movement disorders and epilepsy, they all seem to have a limited amount of professionals who are doing an excellent job, but a limited number of professionals serving the same population. And when these services are provided, they often seem to be fragmented. They may go to a developmental and behavioral pediatrician for their developmental delay. And the same patient may see a neurologist for their seizure management, and then go to a therapist, physical therapist, for their movement problems. When in fact we saw the possibility that Shriners could provide all of those services under one roof and provide them regardless of the ability of the child and family to pay for them. And so we felt that that was quite a remarkable opportunity, and Shriners has given us that opportunity to provide that service in a smaller scale.
That's pretty extraordinary. And so the model of taking care of someone, whether or not they have resources or insurance, applies to all of these disorders as well.
Exactly, yes.
And that's pretty, well, that's pretty incredible. And how is it paid for? There must be a very significant endowment and a lot of people that support Shriners. Is that the model?
There is a significant endowment. The 22 hospitals across the country are supported by the Shriners Endowment. Okay. The Shriners are a fraternity of men, who, mainly businessmen, who have decided to donate their money towards healthcare. And so they started these hospitals that until about 2011 had been running purely on donations. Wow. And starting around 2011, we entered something called revenue cycle and began billing insurance companies if the patient had insurance. Right. And so we would begin to collect. But if it went beyond what the patient could afford or pay for, or it was a financial difficulty for them, then the Shriners would still continue to provide inpatient care for them and outpatient care for them. So we have 2 ORs in our hospital, during which Monday through Friday, I believe we have cases going, not just in orthopedic surgery, but in dental surgery too. Amazing. And we have, I think, a 16-bed unit by which we are able to house inpatients. And we have an outpatient facility too.
And then you have all these teams of people.
That's right.
Tell me more about some of the people that you work with. What other disciplines are in a typical day when a child comes through the Neurodevelopmental clinic? Who do they see?
They'll start with check-in, and they'll see our staff, who are the front face of our hospital. Right. Very important. And the nursing staff and MAs will check them in. They will then be triaged into the clinic offices where they'll see myself, and at times they'll see another member of the team, whether it be care coordination or social worker. When the initial evaluation is done by myself, then we'll make additional referrals, maybe to a physical therapist if they have cerebral palsy. Or if they have autism and they need speech and language services, we'll refer them to our speech and language therapist. When possible, we'll coordinate the visits so that they can be seen on the same day.
Okay.
Miki and I often have visits together within the clinic. We'll sit in the same room, talk about the patient's concerns, and begin to address them together as a team. So we're very comfortable working together within the room, addressing multiple needs for the patient.
Yeah, that sounds a lot like some of the topics that we've discussed, things like patient-centered medical home, medical community concepts, which are emerging all over the state and around the country. You guys were already doing, really. You were fully integrated with your teams, and you started in some ways from scratch just whatever, a year and a half ago or so.
Yeah, and we're finding that families are satisfied when we listen and when we give them the amount of time that they need to address some of these issues. And we provide a diagnosis and provide a management plan moving forward.
Right, and these are families that are really, you know, they're very stressed, right? They have a child always that has some significant need, and maybe that child's needs haven't been met for some period of time through the medical system, the regular medical system outside of your walls. Is that a fair statement?
It's a very fair statement. It's not uncommon for me to see a child come in with his mother, and the mother says, he hasn't talked yet, and he's 5 years old.
Yeah.
What's wrong with him?
Yeah, incredible.
And you see tears coming out of her eyes because she knows something's wrong, but she just hasn't been talked about. And so for us to provide a diagnosis can be quite powerful. We usually have the Kleenex box right there.
Yeah.
And sometimes that's enough for a day.
Sure.
If we assess the child and provide a diagnosis and discuss what that diagnosis means, that's enough for one clinic visit for an hour or 2 hours that we spend with them.
Right.
The management plan moving forward over the next 6 months or a year, sometimes a lifetime, really unpacks what we can do for the child. And in a few cases, we can bring cures to children. In more cases, we help them and we move them forward and make progress, I should say, in their development. But rarely do we actually cure the patient of their neurodevelopmental disability. I think what I've been learning in seeing families and children is the resilience that families have. They learn how to love in a way that many of us in the lay public may not understand.
Sure.
They love the child who may not be cured and who may never speak to them, may not walk a step in their lives. But through caring for that child, they teach us something. They each have a story to teach us. And in seeing many of these patients in clinic, I've been blessed remarkably by seeing the resilience of families, of children, and just how much they can care for their children.
I think that's a perfect place for us to take our first break. And when we come back after a few seconds break, we're going to talk about the kind of cases that you see, the patients that you've embraced and embrace you, and you're providing excellent care for at Shriners.
Thank you.
This is Josh Green, Healthcare in Hawaii. We'll take a short break.
Aloha, I'm Hunter Hevelin, host of Sustainable Hawaii here at ThinkTech Hawaii. You can tune in every week on Thursday at 2 p.m. to see interviews with sustainability professionals from around the state and even further abroad, learning about activities with water management, food security, waste management, and a whole host of other fascinating opportunities to get engaged with making a greener island. So if you're interested in making the transition from consuming individuals to communities of producers, check us out every Thursday.
Hi, I'm Jay Fidel. That's Ted Ralston. You know, Ted is the host of Where the Road Leads. It shows every Friday from 4 to 5 p.m. It's about technology. It's about how people collaborating and solve problems with modern technology. It's where the road leads. We all know that. We should all be listening. Join us there, 4 to 5 p.m. every Friday. Now, what about that do you agree with?
All of it.
I knew he'd say that. Aloha. Say aloha.
Aloha.
Good.
Aloha, Yappers, and a Happy New Year. I'm your host, King Zilly.
From inner city out to the platform and now the YAF show. It's a new year, and most would say a new beginning. So this is a call to action. As we promote tech, energy, diversification, and globalism, with ThinkTech Hawaii, the YAF show is all about advocacy for effective leadership, comprehensive youth policies, programs, and access to knowledge and information for upward social mobility, especially for the historically underprivileged youth. This means we'll be looking at young people making a difference in their community. Youth policies here in Hawaii, the country, and the world. We want to highlight youth programs that are meeting young people where they are, working together to accomplish a goal or tackle an issue while providing information and access to free educational content for anybody looking to learn on their own time, study for an exam, or simply refresh their memory. We do this by inviting everyday people like yourself, state policymakers, youth advocacy groups, youth programs, professionals, and so forth. But most importantly, we'll be partnering up with my new organization, causeeffect.org. More information on Cause Effect, as this website is currently in development and hopes to feature courses, seminars, tutorials, and conducting surveys that will be featured on the show. As we leave behind 2014, I wish I could say we leave behind issues such as police brutality, youth violence, education, economic mobility, and so many other hot-button topics that made 2014 a difficult year. So what does it mean for the new year? What does it mean for youth policy? What does it mean for Hawaii as a whole? And most importantly, how does it affect you and your community? We want you to tune into the YAP show at 3 p.m. Friday and find out. Aloha.
Aloha, welcome back to Healthcare in Hawaii. This is Josh Green. I'm chairman of the Health Committee at the Senate and ER physician on the weekends. Today I'm joined by two extraordinary individuals, Dr. Ryan Lee, who's a neurodevelopmental pediatrician at Shriners, and Miki Wong, who's a registered dietitian. They've been trained here. They've been trained also at some of the universities on the mainland. I know that Ryan was over at Hopkins for a few years where my dad was, and they've devoted their lives and their professional time now to see patients at Shriners who have real serious challenges in life. These are young children, usually, who, when they present to this team, this care team, have a family that is often in crisis. They need answers and they need support. So in our first 15 minutes, we were able to begin to explore what the mission of Shriners is and what this neurodevelopmental clinic has as capacity. So thanks again for joining us. Where we left off, we were talking about some of the services that you offer and what it's like to see a child for a couple hours and to begin the process to give a diagnosis. What are some of the diagnoses? What are some of the main problems that you see in mass? Where are we seeing our biggest issues? Why don't I start with you, Miki? What kind of patients?
Okay, within the neurodevelopment clinic,
Yes.
we're seeing a lot of kids with autism,
Okay.
a lot of ADHD.
Yes.
We're seeing kids with seizure disorders, with migraines, and a lot of miscellaneous diagnoses that fall under the umbrella of neurodevelopment.
Yes.
Um,
How many people come to Shriners? How many patients do you have in the neurodevelopmental clinic?
Oh boy, I have seen, I would say about at least 750 patients or visits since the neurodevelopmental clinic started in 2013. I would estimate I have about 100 patients with autism.
Okay.
So I see about 5 per week, roughly. The majority of my patients have ADHD. believe it or
Interesting.
not, yeah, which is a very common disorder in today's community.
Yeah, you know, that's fascinating to me because I think, you know, I was trained in family practice and I practice ER medicine now, so I often don't treat the subset of patients that you treat because you're treating large problems that are going to go on for many, many years. I tend to be just working on the acute thing, but some of my patients do have ADHD. Some of the children that I see are autistic. They may come in for a laceration or just a regular infection, ear infection like any other kid, but what you do is to deal with that whole family and that child's life. How many people do you see in a day? How many patients are in a normal day?
I may see about 8 patients a day.
Right. So it's a very intense hour or 2
Hour,
hours
2
that you
hours.
spend with people.
Right.
Now, you mentioned autism and ADHD.
Yes.
Autism that I'm reading and learning about, there's been a discussion that the incidence is climbing. Just a few years ago when we had legislation at the Capitol, we were saying that the incidence of autism was 1 in 200 or even less frequent. Now I think the number was 1 in 68, I believe, was testified to. Why are we seeing more diagnoses? Are there more cases? What's your feeling about this, guys?
That's a great question, Josh. Autism is definitely on the rise. The number 1 in 68 came from the Autism and Developmental Disabilities Monitoring Network,
Okay.
a network of 14 major centers or hospitals throughout the country, Hawaii not being one of them, by the way. But the latest data from 2010, published I think in 2012, suggests that the newest prevalence is 1 in 68. That's a significant climb up from 1 in 88 the previous 2 years that they've conducted the same study, same methodologies. And previous to that, it was 1 in 110. And so we're seeing a growth in the prevalence of autism. Now, many people are asking, what are the causes? If we take genetic causes alone, depending on which type of testing you do, it may only account for about 20% to 50% perhaps of all the diagnoses of autism.
Okay.
So that leaves at least 50% of autism that is relatively unexplained or perhaps caused by environmental causes. And there was a recent bill on pesticides and buffer zones as a possible antecedent to causing autism. And although we can't prove causation, there was an association found in a recent study by UC Davis last October 2014 that looked at buffer zones around California. And if you lived within a mile of some of these high spray areas for certain organophosphate pesticides, you had an increase in about 60% of having a child with autism, with second trimester exposure being even higher. And so some of these environmental studies that are being conducted now in states such as California are beginning to reveal some of the potential environmental causes for autism. Further studies are needed. We are, as a neuroscience community, we are doing fairly poorly in studying the environmental causes for autism. And so as we grow in the field, we would like to not only explore the genetic causes, which are abundant, and we're learning more and more every year about what are the specific gene mutations that might cause a child to have autism, but on top of that, environmental causes, such as exposures to toxins, are going to become increasingly important in our understanding of the neuropathophysiology of autism.
So when you guys go to conferences and you speak with your colleagues, are these the kind of conversations you have? I suppose some of them are actually doing the actual research. You probably are very familiar with many of the people in the discipline. Are these at the scientific meetings, are these the centers of attention?
Right. Both definition of autism, diagnosis of autism, comorbidities, but also the causes of autism. Because when we talk about neurodevelopmental disorders, such as autism or intellectual disability or even ADHD, we are not conferring a specific cause or an etiology. Rather, we're conferring perhaps multiple, hundreds if not thousands of different causes. And so research needs to be done, yes, on the front end for discovering what are the causes, but also on the back end. What can we do for people who already have autism? What can we do to help them be gainfully employed? How can we treat autism? And that's something that we're quite excited about at our hospital. We have a new program called the Ketogenic diet.
Let's actually pivot to that. I think that's great. So we've established that these neurodevelopmental disabilities are on the rise. We don't know the exact cause, but we seem to now have some connections to concerns, whether it's environmental factors, plus the genetic factors, plus goodness knows what. But people come to you for help. And when they are diagnosed in the course of a few visits and they get a diagnosis for their child is on autism spectrum, you now have something to offer. So Miki, I've heard that you guys are doing some very extraordinary work with diet, and many people have told me over the years, and again, as a family doctor, we always talked about diet being a very important part of our treatment modality for all illness. The diet is central. Tell us a little bit about what you guys do for children with autism.
I think it applies to kind of all of the diagnoses, ADHD and other disorders as well. A lot of the parents are coming and they're saying, I don't want my kids on so many drugs, or they're on these drugs and they may address one aspect, but their behavior has changed, or my son has disappeared, you know, it's not the same anymore.
Yes.
And they're kind of looking to sort of more natural alternatives without side effects and things like that. So a lot of them come in with sort of that interest, and so we've had a lot of parents of kids with autism. We've tried gluten-free, casein-free, and some have seen a big improvement, and some not so much. And so that sort of sets up the stage for what we're trying to do. You know, we have these families who are very interested in a natural approach, and so we're working on a study to test the ketogenic diet in kids with autism. We have one that's already started for epilepsy, and there's a lot more research with epilepsy and diet. Sorry. But we're trying to do additional studies along with that.
Let me actually have you pause. Give me kind of the lowdown on what a ketogenic diet is. For those who don't know, what does that entail?
So ketogenic diet, as you could just in the title alone, is designed to get the body into ketosis.
Yes.
Ketosis occurs when you take most of the carbohydrates away.
Yes.
And in order to take the carbohydrates away and not starve to death, you've got to raise the fats.
Okay.
And the body then produces an alternative fuel called ketones from all of the fats that you eat in your diet. It can also pull it from your body as well. And so by getting the body into ketosis, you know, we can, that's what exacts some of the changes, although we don't know the mechanisms of it.
Yes.
So the diet itself is very high in fat. It's mostly fat. So contrary to sort of the direction that our country has been in, low fat, this is high fat, and we're talking 75 to 80% or even higher percent of calories coming from fat, and about 5% from carbs, and or 5 to 10% depending on which ketogenic diet, 10 to 20% from protein.
And what results do you see when you see a child that's presented to you, say on the autism spectrum or with ADHD? Do you see immediate improvement? Is there a great deal of just, you know, a range of response? What's it been like?
Let me talk. Let me step back just a little bit about the history of why the ketogenic diet for autism.
Sure.
There's been one study done in 2003 at Greece. Evangelo studied 30 children with autism. 12 of them couldn't maintain the ketogenic diet. They didn't tolerate it. So that left 18 of them. And these children ranged, I think, from 2 to 18 years old. And they remained on the diet for 6 months, 4 weeks on, 2 weeks off.
Okay.
And then 4 weeks on, 2 weeks off for 6 months. Well, the results were that all of them had some sort of improvement in their core features of autism. And so that sparked an interest that perhaps a ketogenic diet could be used to treat autism. Since then, there's only been one case study published, and that's why we're interested in it. These studies have not been replicated, and we feel that we need to see what is the effect of the ketogenic diet on autism.
Well, I think that it makes me feel proud that we're doing some
pioneering work.
Exactly, pioneering work here in the state of Hawaii. We're going to take another little break, and then we'll return for our final segment. This is Josh Green, Healthcare in Hawaii. I'm joined by experts from Shriners, and we're talking about neurodevelopmental disabilities. Thanks for joining us.
Hi, I'm your host on ThinkTech Asia, Bill Sharp. I look forward to you joining us each Monday between 4 and 5 o'clock when we film right here in our studio in downtown Honolulu. The show, ThinkTech Asia, focuses on contemporary events in Asia. And by Asia, we mean anything from Hawaii, south to Australia and New Zealand, west to Pakistan, and as far north as the Russian Far East. Clearly, this is one of the most economically dynamic centers of the world, and we bring you up to date on what's going on in a whole host of countries in this very vital region. We look forward to seeing you. Aloha.
Aloha, welcome back to Healthcare in Hawaii. I'm your host, Josh Green, physician from the Big Island, senator also from the same area, chairing the Health Committee. Today I'm joined by two specialists over at Shriners, Dr. Ryan Lee and Miki Wong, who work on neurodevelopmental disabilities. A lot of people have been discussing autism in the last few years. The incidence of autism is now, we believe, 1 in 68 children that are born. That's well over 1% of our population. We have that challenge here in Hawaii, and there's been a very vibrant dialogue about how to help take care of people. Right now, private insurance does not cover treatment for autism spectrum disorder. That's changing as we speak, I believe. The Medicaid program now is covering it, but these good people who I've introduced to you in the first half hour don't care whether insurance pays. They don't worry about what the government says should or shouldn't be reimbursed. They just take care of patients. And they've been innovators, so I turn back to you guys. In our previous segment, the last 15 minutes, we had just begun to touch on the ketogenic diet and how you're incorporating that both as kind of progressive approach to these disease states and how it was done in Greece on a small number of people, but you want to add to the scientific literacy on the matter. Why don't you tell me a little bit more, where did this ketogenic diet come from? What's the history of that?
It's a very old diet, thousands of years old. In fact, as early as Hippocrates in the Corpus, or some of the documents written by Hippocrates and his students, discussed that fasting could cure one of seizures. And so about 90 years ago, 1920s, the diet became, or the fasting became popular for treatment of epilepsy. The diet really emerged in the 1920s and 30s out of the Mayo Clinic, when fasting for 20 or 30 days to treat seizures was not a preferable treatment. And so physicians out of the Mayo Clinic had invented a means of eating food, high-fat, low-carbohydrate diet that would produce the same state as fasting, which we call ketosis. And this provided the body a different kind of fuel, almost like a hybrid car, that could work off of ketones, and the brain could function off of ketones, and at times maybe preferred ketones. So the patient with seizures tended to have at least a 50% decrease in seizure frequency and severity in at least half of patients. And in many patients, it can be curable. And this diet fell out of favor in the 1930s and beyond because medicines were invented. And medicines, as you know, have their place. They're very important for the treatment of seizures. But the diet fell out of favor for decades. And only starting in the 1990s, I would say, did a film popularized by Jim Abrams, Do No Harm, Meryl Streep, revive the diet in a sense. Jim Abrams had a son who had intractable epilepsy. He went to Johns Hopkins to look for help. Johns Hopkins had been maintaining dietary intervention throughout the 90 years. And so professors at Johns Hopkins initiated the diet, and Jim Abrams' son became seizure-free. Jim Abrams, a film producer, became so passionate about the diet that he started a foundation called the Charlie Foundation. And from that foundation, named after his son. Yeah. And from that foundation, many centers have emerged, including our center, and they came and trained us not long ago in how to implement the ketogenic diet for the treatment of epilepsy. And so we believe that the ketogenic diet is having a revival, in a sense, for the treatment of not just epilepsy, but exploring other possibilities such as brain tumors, migraine headaches, Alzheimer's disease, Parkinson's disease, and autism. And so we believe that it may be a treatment for obesity. We haven't touched on that yet, but we hope that that's a possibility too.
Well, it's all very fascinating to me, and so it's nice to see that you guys are working together, both to have a dietitian who's, has expertise in this area, have a doc that believes in diet as a part of treatment, because I've got to tell you, the flip side of it is, it's very obvious to me, seeing a large breadth of society, that processed foods, very high carbohydrate diet is causing just an incredible burden of chronic disease. And it's not just obesity and diabetes and heart disease. It's so many, many, many things. I would not be shocked at all if over time we find very heavy connections to depression, which is one of our largest diagnoses that we don't maybe talk about as often, but so connected to what we're eating. So to emerge from Hopkins and to see us doing it in Hawaii makes a lot of sense to me. And my hope is that the kind of publications and the research that you're able to do, while at the same time helping these, well, you said over 750 individuals already, and just in the last year plus of treatment here at the clinic, will make just a tremendous difference. So how does it go? Do you enroll people into both the treatment plan and the study at the same time over at Shriners? What are you guys doing?
So we started the epilepsy study. The autism one hasn't started yet. So the epilepsy, we you know, they get identified in the clinic, and then I go in and see them, do an assessment, and we do pre-teaching. It's not an easy diet to just jump right into, so it takes time. The parents have to sort of read on their own. They have to practice. They have to try some of the recipes. They have to practice taking the rice away and some of the noodles and finding substitutes.
Yes.
And the food is good. It's amazing. Fat tastes great. So it's not like you're putting them on cardboard,
Right.
you know. But they have that process of sort of getting ready, and then if they opt for the classic diet, then they're admitted to the hospital for 3 days.
Okay.
And in those 3 days, they receive a lot of intensive education. We monitor them metabolically as they go into ketosis.
Yes.
And they get education from the nurses as to signs and symptoms of like this hypoglycemia and excess ketosis and things like that.
Right. Very fascinating. And are you able to, you're probably very close to these families and to the patients, so you're probably a very good follow-up, I would guess. Will you now be launching the study and the research, do you believe, on autism? Is that something that's in the
In
cards?
the next month, we hope so. We have currently 5 patients with epilepsy on the ketogenic diet. They're all doing very well, I'll
That's nice
say.
to hear.
And we're seeing other effects
and-
beyond the seizure reduction.
Remarkably,
which
yeah.
is just amazing us.
You're seeing other like improvements in their
Improvements,
neurodevelopmental
yeah.
status? Is that what you're seeing?
We are. Children are becoming more aware of their environment. These are children with significant disabilities that the parents know best.
Yeah.
And they're saying, so-and-so is now looking out the window and more aware of the cars going by. They're looking at me now. They know when I come into the room. Their tone is better. They're not as spastic. They're wheeling themselves on their wheelchair now, which they've never done before, and these are teenagers. And so we're seeing some added benefits aside from seizure control, and we're excited about some of these added benefits too.
It makes me wonder if we're not, and this is going to sound a little inflammatory, but it almost makes me wonder if we're not poisoning ourselves with sugar, you know, in America. I know that that's an extreme statement, and I've said things like that before, both here and at the Capitol, but the large amounts of sugar that we put into our systems, we know causes lots of problems. I mean, we know that our bodies are not equipped physiologically to deal with the insulin effect of large amounts of sugar.
Absolutely.
And we know that that resonates in our bodies in a lot of different ways, but some of the conditions that you're talking about helping with are they're very difficult to, you know, to describe numerically, and it's very difficult to, like you said earlier, to have a clear causal connection. But as you see a total change in people's lives, I think you're going to be able to report some very meaningful findings. Now, is it just you guys? How many other people are part of your team for some of this research and care and you know, compassion for kids with developmental disability?
We have 2 nurse practitioners that are part of the team, and we have pharmacists that review the medications, the inpatient nurses during their stay, and then we have a care manager that kind of coordinates, a lot of coordination with their labs and the medications and their vitamins and things like that.
We have administrators who are really helping us with policy and developing policies in our hospital to care for these children too.
I assume they're very supportive of the work you're doing because you're really one of a kind, I have to say. Here in Hawaii, I understand that there might be or must be some other people peppered around the country that are beginning to take a look at ketogenesis and its impact on developmental disabilities, plus the many other things that you do for children with autism, with ADHD. But it's refreshing to know that administrations are taking to heart what you clinicians are worried about, because I think there was an era where it was all throw medicine at people. I remember when I was in medical school, which was in the mid-90s, we looked at psychiatry as a very, very pharma-based discipline. It had moved away from cognitive therapy, had moved away from talk therapy, and had moved into a very, at least where I was trained in Pennsylvania and up in New Hampshire, you're going to be prescribing a lot of medications. That's the only way to really get control of some of these very complex problems and challenges. And I always wondered about that because I knew the very core patient population and their families were inherently concerned with what caused these developmental disabilities. Was it, you know, were there causation things that we gave them early on in their lives? Did they get exposed to heavy metals? Did they get exposed to toxins? Is that why this happened? Was it a contributor? And then we're adding on other chemicals, which made a lot of these moms and dads really concerned. And I know there are times and places for medications, because I've definitely taken care of children that had severe need, intractable seizures they couldn't live through. Sometimes their spirit and mood and passion with their autism spectrum was just too much even for the family to live with, and so they had to have help. But to see you do something natural is going to be very meaningful to a lot of families. Now, how do we get more people to find you, to come to the clinic? Do you have a long waiting list? Are people now becoming aware that Shriners is no longer an orthopedic facility, and that
they're beginning to be aware now. We have a waiting list until April, which is about 3 months.
Yes.
And we hope to keep it down and not get too long. So we're working hard every day. But they simply can call Shriners up. I'm the only neurodevelopmental pediatrician at Shriners.
Yes.
And so they can ask for an appointment with us.
Yes.
When they come through the triage, they will get the full array of needs that we can provide for them.
It's fantastic. And it won't matter whether they have insurance. It won't matter if they have come from Ka'u or from Honolulu or wherever. You're going to see them.
That's the Shriners mission.
And a lot of insurance doesn't cover very much dietitian services anyway, so our dietitian services are free.
See, we like free healthcare. I grew up in the community health center world, right? And that's how I came to Hawaii, was National Health Court. So I never billed once, you know. I mean, I know that the health center did bill some, but we saw everybody that came through. So it's very different than Shriners. You guys are far more extraordinary than we were, but we did take that tact, right? If someone came through the doors, we were going to provide them care. You take it to a whole new level. Is there anything else you'd like to add? We've just got a couple minutes left for Hawaii, for your vision for the children of Hawaii. That let's just stick to autism for now. What would you like to see in the coming years as far as availability for treatment? What would you like to see the world do for these families that are now a part of this scary statistic of 1 in 68? What can we do?
I'd like to see your bill passed.
Yeah, that's a shameless promotion, but very kind of you.
You didn't have to say that. I would have said it anyways, because that is going to be a historic marker in the field of autism for Hawaii. We want treatment paid for our children. That would expand access to care for these children. And so while we are attempting to be creative for their treatments, such as the ketogenic diet, we still think standard therapies, such as ABA therapy, are needed. None of these stand alone.
Right.
And so we thank you for your work. And what can we look forward to? Well, we hope that we can continue doing the work that we're doing. We enjoy the work that we do at Shriners hospitals. The Shriners have been amazing in allowing us to see families grow. And so if we can continue doing that, I think we'd be happy. We do want to see change, and we want to be bold. We want to be innovative. Not just the ketogenic diet for epilepsy and autism, but maybe for many, many other things too, such as obesity. In fact, we had a ketogenic diet dessert that we were going to bring for you today, but we forgot it at our hospital. So we'll drop it off at your office tomorrow.
That's very cool of you. Well, and last word, Miki, what would you like to add to what Dr. Lee had to say?
I think for me, it's just, I'm so excited about the ketogenic diet as a therapy, and I think it's beyond what we can do at Shriners. So I'd love to see it sort of expand, where it's not just a few centers here that do it, but that there's many centers that do it, not just in autism and obesity, but also in diabetes, you know, in cancer treatments, and a lot of these other areas in mental health, things like that, where I think it really could have a benefit.
Well, I think it's been a terrific 45-minute segment today. I'm so pleased that you were able to come and share what you do at Shriners. I think, for me anyway, it really has opened my eyes to what the capacity at Shriners is, how you guys are transforming the healthcare of our state for our children who have very, very significant need. These are wonderful, wonderful, loving children, and Shriners is a huge part of our healthcare system. So until next week, this is Josh Green, Healthcare in Hawaii. Thanks for joining us.